blast. I went out yesterday, but I'm up. I'm up and here, live. You see, no one will know I went out yesterday. No one will know. um, yes, welcome, welcome. Please, as you come in, just say a little hi, just so we know the people that are here and we're good to go, right? Please just say a little hello. Hello. I'm just gonna pop in something here as well and say hi. Hey, share Badr Khan. I see you. I see you. How are you doing? Thanks for joining in. Hey, yeah. Okay. So, um, I'll just. Hey, I see you, Precious. Welcome. Hey, I see you. Please, for those of us who are here already, I say very big welcome to you. But please try to reach out to those who may have forgotten or they've slept off or something, or those of your friends you know would like to join in the session. Please just share the link with them and let them join in. The way we'll be starting is normally I usually have a presentation sharing on tips on what we can do and those things to avoid, and then also then taking on questions. I would normally take questions, which is most likely the best way. And the advantage of the question is that when you ask questions, people are able to respond, and when I'm responding, everyone is able to gain from it. And then if there's any idea, we can share ideas and we can say how to do things better. So the best way for us to do it is to pop in our questions. If you've got questions, we need to pop in the questions and then we can work with that. And then also share the recent changes. Some people are still struggling with the recent changes. So if you have anybody like that here, we'll also like you to pop in your question or wherever you feel is a gray area, and then we can work with that. But for to start now, should we start with what to avoid, the errors not to make? That's my own tips I like to share with people. Or should we start with the questions? Please, I'd like you to pop in the answers in the box, please, in the chat box, just so that I'm working with you. I'm not working on my own in my own head. You know what I mean? So please, what do you think? Should we start with questions or errors to avoid? Okay, okay. All right. So one person has said something. Yeah. If you have any other opinion, um, so should we go with out? If we don't have any more comments on what we should do first, I'll just start with this errors to avoid and things we should do. Okay? Right. Okay. So I'll be starting with the common mistakes people make. Common mistakes. Now, especially for your assessment station, your implementation station, I found that some people are still talking extra. Remember, the goal is not to try to impress your assessor. That's not the goal. The goal is to show competence. Okay, that's why it's called, it's just checking out your competence to see if you're fit to work in the UK system. You guys are all fit, but you need to show it. And how can you show it? You need to factor in time management. You need to factor in that you hit the key points, and most key points you find in your marking criteria. Sometimes I know it may be difficult, but I encourage people to work with marking criteria and the manual. The manual is what we have created. We've developed added flesh to the marking criteria. So work with your marking criteria. You can't miss the key points. However, there's some things you need to know how to do as well. Okay. So for assessment, please keep to time, keep to the right information that you need to share. And please, when you speak, make sure you're very audible. I've heard some people talk, blah, blah, blah. Please, bedroom voice don't work. I say it a lot when we come to OSCE stations and the practices. It don't help because you find out someone then says, this person didn't say it, and all of that. Okay. As audible as possible, and then manage your time properly. Go in straight, come to my patient room, check for scene safety, perform my hand hygiene. I once heard somebody say, and I take my, this is my hand sanitizer. I will take my hand. Please go straight to the point. Go straight to the point. Say what you need to do. As you walk, your eyes on the time. So it's like your goal is on, your eyes is on the goal, which is the time. Because some people get into it, especially those that really know what they're doing. They get into it, they give details, but then time is a challenge because your time will not be paused for you, right? And so sometimes you have an assessor who is going to tell you, oh, you need to hurry up now, you've got 5 minutes, or some will say you've got 3 minutes. But what if you get those who don't say anything? Some assessor won't tell you anything, they just watch you. And once your time is up, they tell you time up. So please, for this for this station, such as the assessment and and the implementation, you want to make sure your chat is on point. We've still had issues with people who are not chatting properly. You know, it's very painful when some people are going to write just for chat. So the strategy we have agreed, or I've really encouraged people to use is, once you write on your numbers in your normal chat, what you need to do is strike it off once it is in your chat. Strike it off. When you put your temperature, strike it off. You put the pulse, strike it off. That will help you be sure that all of this is done. Now, the new thing that we have all seen, and I'm sure we are all aware of, is the GCS chart that has been changed. Now, if you're very observant, you would see that two things have been changed in your DCS chart. Okay, I'll check what Shay has just said. Two things have been changed. Now, looking at your respiration and the oxygen saturation. When I post this video later, I might just be able to edit the different charts and the differences. Okay. Now, the respiration used to be up together with, the pulse and all of that. And then the oxygen saturation used to be at the bottom with your signature and the GCS total. Now it has been changed. It's been changed, whereas you now have the respiration ruled out from pulse, but it's still up, and then the oxygen saturation. Most likely, please write your oxygen saturation and your respiration in numbers. Write them in numbers, but you must be sure to look that you're writing in the right box. Now, those boxes, each box represents 10. So if you put your figure in the box of 0 to 10, I mean, your patient's respiration cannot be 9. Okay, it can be 8, it can be 10. So you want to make sure you're putting your respiration figure in the right box. It seemed a bit not clear, but I remember explaining to a few people yesterday about the box of the GCS. But if you think you still don't understand it or you're having issues with it, please let me know. Just put a comment in there and then I can try to figure out. I'll try to see if I'm not sure I'm able to pop in anything here. But what I can do is when I'm editing this video, I'll pop in the chat so you see it. Please. I mean, it was really hurtful when people had to go back just for that correction. I'm sure so many of you have learned. There was another situation where someone had to go back just because they didn't put in their blood pressure. Okay. Again, please use the strategy of as you write, you strike off. Okay. So let's assume you have blood pressure and then you have a pulse, you have your oxygen saturation, temperature, and what's the last one? Yeah. So what you do is as you write in, I don't know if you can see this. If you write in your chart, strike off. Okay. Strike off in a way that you can still see the numbers, but it means you've represented it in your chart. Please, let's try as much as possible not to allow this happen. Okay, I don't want to overemphasize this so people don't only focus on their chart. But the thing with chart is when you are done with your procedure on assessment, reserve time for going back to check your chart again. Some people use their time. They say they've got 3 minutes and they're beginning to ask activities of daily living question, activities of daily living question. Please, yeah, I know you want to ask certain questions that have to do with your patient's condition and all of that, but I think it's still very important for you to go back, check that your chart is properly done. Okay, some people finish and then they discover they didn't put the news total. Please reserve time to do all of that. I'll just read what checking. Some people still struggling with all checks done. Can you please explain again? Right. I think I would like to take questions in between just to help people who have got questions. Okay, so when we hear all checks done, okay, all checks done. Now, depending, please let's be open. Again, we need to be open to listen to what our assessor says. I'll give us two situations or three options. Now, this so that when you get there, you need to know what to do. Please, when you hear anything different, don't freeze. Okay, don't be destabilized. Rather, think. Okay, think what's the next step? What do I do? And then act. All right. So it's a process. Okay, listen, think, and act. It's just a process. Don't rush it. So you come in and they tell you all checks done. Let's assume this assessor doesn't explain to you what all checks done is. If it's a procedure, maybe a skill, most likely they do it for all skills. Okay. If it's a skill that is not doesn't involve medication, okay, if it's a skill that doesn't involve medication and we know what those skills are, let's assume catheter removal or CSU or MSU. Want to hear all checks done is I come into my patient, I perform my hand hygiene. I see that my sanitizer or my hand gel is within date 2023, no precipitate. Take an ample amount, perform my hand hygiene with the 7 steps of WHO. Hello, good morning. My name is Bella. I'm here to, okay? So you just go straight for what you're here to do. I'm here to take off your catheter. It's not a painful procedure. It involves me doing this. Explain the procedure. Hello, for all those are coming in. Hello, hi. Thanks for joining in. Yeah. Explain the procedure to the people, to your patient, and then ask them if they've got any question. Tell them it's not a painful procedure, all the things you need to do. So, brief explanation, very brief on what you're here to do. Do you need a chaperone? So, depending if your procedure needs a chaperone or not. So, you do that and then leave. Okay, so if you don't mind, here is the call bell. I'll be going to get the requirement for my procedure. Is that okay? Perform hand hygiene, leave your patient side, go there, then get your equipment and go back. That's when you are not told anything, you are just told all checks done. So if they tell you all checks done, this is another scenario. Now, all checks done, everything is in date, the equipments are clean and ready to use, ID check done. Now, ID check done. I'm sure they won't tell you ID check done in a medication station, such as VIP or administration of suppository. Okay, they shouldn't tell you that, but if they do, please remember you must still do your ID checks. You can't miss your ID check. All right, you can't miss your double ID check. So but for the one we're doing now, they tell you everything. So all you need to do is what they're expecting from you is to go in, take your equipment, moving straight to your patient and start up. So what you do from there is if they tell you ID check done, everything is in date, nothing is expired, they tell you all of that, cleaned and prepared, ready for use. I come to my scene, I perform my hand hygiene, I pick up my equipment. Please just go straight, take up your equipment. So it means you need to know your equipment, what you need to use for the procedure. All right, take in all your equipment, then go to your patient, because it is assumed that this patient knows who you are, you know who you are. Remember that they would read the scenario to you. Your assessor would read the scenario to you. Okay? And please, if your assessor does not, if she reads the scenario, you don't understand, please say you don't understand. Say you don't understand. I've always said it and I'll keep saying it. Please, you need to learn to speak out your thought. For every time you are stuck or you see something and get confused, before your time starts, Ask the question. It's your right, is what you should do. They're expecting you. Some assessors will go as far as saying, have you got any questions before we start? Okay. So if they tell you that, please ask the question. If you see something that looks weird, something you don't know what it is, ask a question, please. Okay. So share. I hope I've been able to help answer the question for all checks done. Um Yeah. But if you think there's anything you want me to say about that specifically, please just put it down there and I'll be able to I should be able to respond to that. Okay. So thanks for that for that one share. So for those of us who have just come in, if you've got questions, please pop it in there. I'm still going to continue. All right. Okay, great. Thanks, Share. I'm still going to continue with the tips, what we should do. Okay. Now, I want to also share with us, I need to bring to our consciousness that at every point we are using different pens. So, most likely, that is your API. So, most likely, the pen you use in assessment is different from planning, is different from evaluation. Okay. So, please realize that because you may not be able to do certain things once you've moved. Okay. Now, so I've talked a bit about second ID check. We can't meet second ID checks when we get to any implementation station. We can't. Any implementation station, we can't. And what are these stations? We're looking at VIP, we're looking at administration of supersetory, normal implementation station, we're looking at oxygen therapy. Because some people just look at oxygen therapy as a skill. Yeah. Hi, Chidima. I guess that's Linda. Yeah. Hello. Thanks for coming in. So some people look at it as a skill and then forget to do all of these things that we do. So if I were you, you want to list down what are those skills that we will do second ID check for? What are those skills that we will check five rights, that will check validity? Okay. List all of that down, know it so you don't miss it. Right? So another thing, there was someone who now I want to dwell so much on those changes that we already know. I won't dwell so much on those things people, those errors people do a lot. But now I'm going to bring points about those who have failed a second time. Okay? Because people focus on one particular thing. So please focus on everything at once. As you practice, some of us are very good in certain areas. We are good and we know it. So people focus on certain things and leave other areas. That's a mistake people make. Please, I know it's a whole lot. You need to learn 100 different things. Yeah, I know, but try to associate different things together. Compartmentalize certain things to be sure that, okay, when it's this scenario, there's similar things I will do when I get to this scenario. If it's another scenario, there are different things, set of things that I will do that are alike. This will help you stay with the skills you've got and help you keep your skills in your hands. Okay? All medication station, whatever, be it a skill, be it implementation, you can't miss confirming allergies. Please, you can't miss confirming. Start in your head, put it there, build a structure in your head. Can I know your name, please, and your date of birth? Have you got any allergies? Those three must go together. If you go that way, we will not have any issues with allergies, especially in all stations that have to do with medication. We will not have any problem with allergies. Can I know your name and your date of birth and your allergies? Okay. Now, the difference is if you've got hospital scenario or community scenario, we need to know what to do. We know that we're not checking wristband in community scenario because they wouldn't have the wristband in their houses. All right. So please, you can't miss out your allergies. And then your expiry dates. Expiry date, this is specifically for implementation session where you have to take the oral tablets. Okay, we can't miss the expiry date. So your easiest way to go about it is, as you pick your medication, I'll be giving, because you know you've read your prescription, you've dotted the medications you're giving. When you pick the medication up, I'll be giving it amlodipine. It comes in 5 milligram. The expiry date is August 2024. I'm happy to give. Okay, so for some people who do their 5 rights, you could do your 5 rights there, or do all your expiry dates, read all the prescriptions, and dispense all the medication, then confirm your 5 rights. We all have different ways of working. Look for what works for you best. That's what you should do. Okay, we've had issues with people, medication documentation. Please, we can't afford to have a wrong documentation in implementation. Implementation is one of the longest station that takes our time. So we must learn to cut out unnecessary talks again, right? You see all those, what name do you prefer? I call you, please, if you don't mind, sit properly. You don't need that in, you don't need that. Someone has popped a question, I'll answer it. You don't need that in implementation. You don't need what is your preferred name. You don't need what brought you here. No. Let me put the picture for you guys so you can have this structure in your head. So, API is a process. Okay? Assessment is you're meeting the patient for the first time. So, there are key things you must say and ask. That is your assessment. So, your planning is, I'm planning for this patient who I have met on admission. That is your assessment. Okay? I've planned for this patient, and I then need to do their implementation. I need to implement their care. One of the things we're implementing is the medication. So we stick with medication here because that is the skill they can see you perform. Okay? So if you look at it as a process, have the structure, you know that you don't need to ask, um uh what name would you prefer I call you. Please save your precious time. The time is too precious. Save it. Okay, because we had a couple of situations where people's time ran off just at the point of signing their name, just at that point. So if they had managed their time properly, they would not get to that point of not signing. And we know as nurses, if you don't document, it's not done. And so when they get the feedback, you would see the reason why somebody has to rewrite just for not. They would explain and give you one superb reason. So I would employ you. We all know how to read our prescription charts. So for those of you who are still reading, taking time, when you're reading the patient's name, the name is Jack Smith. The date of birth is 1st the 1st, 1980. The hospital number is 001234. The doctor is Dr. Escan. The bleep number is 1155. And the height, weight, read that. On the next page, I confirm I have the same details for Jack Smith. On the next page, I have the same details for Jack Smith. On the next page, I have the same details for Jack Smith. And on the last page, I have the same details for Jack Smith. I confirm the prescription is for Jack Smith. You're done with that. Go straight, read all your prescription. Please, as you are reading, dot only the medications you are given. Dot only the medications you're giving. Don't miscalculate by dotting the ones you're giving and then putting an X for the one you're not giving. The one you're not giving, don't touch. Just put a dot for the ones you're giving. That will help you so that when you're done reading, you read up to the point of omitted doses. When you get to that point, you confirm. I confirm that this prescription is valid, is legible, contains prescriber signature and bleep number. That's another key thing. They're listening. They want to hear from you. Okay? So when you do that, I confirm that this prescription is valid is legible, contains the prescriber signature and bleep number. I'm happy to dispense. Then you go and then start dispensing your medication. Okay? So please, when you do, I'm saying all of this to help us save time so we can properly document. And we need to know where to document. We need to know where to document. There are two different types of documentation, okay? In implementation, you've got the community documentation, that's prescription, and then you've got the hospital prescription. For the hospital prescription, please, I like us to get this clear because people still made errors with it. For hospital prescription, the once only medication has time because it's assumed that the doctor has prescribed this and the patient needs it now. That's why it's called a once only medication. Okay. So for the once only medication, the time is there. Your job is to sign. Okay. Most likely the date is there and all of that. But to help you and to help your, your anxiety self, okay, you can just put your date and your time. There's the your signature. So there is the time already on the column, and then you have a space for signature and a space for the time that you specifically put it in. Okay, so please put in your signature, put in the time that you give. Remember, once only medication, sometimes it was prescribed at, let's say, 10 a.m., but you are giving it at 10:05. So that's why you need to put in your own time. So for the purpose of exam, you will then put in your examination time, which is on your front sheet. That's going to be the time you are given. Okay, so that's for once only medication. I'm still on hospital prescription chart. When you get to your regular medication, your business is your time. What is not your time is not your business. Okay, so because it is your time, it has got the time there. However, you will read everything. Give what is your time. If you see 6 a.m., 12 noon, 1400 hours, 1600 hours, and your examination time is 1200, please go to 1200 hours. Check that that medication is okay for you to give. It is due. The patient is not allergic to it. Hours, please. What else? It is due. It is within the time frame. Once you have given that, sign and date. Now for regular medication, we have just one box for signature and date. Please put it there because it has got the time by the side. Your job is then to put signature and date in that box. For those of us that have big signatures, please put initials. If your name is Bella Bidako, you put the B dot A and then you put the date underneath it. Okay, that is for regular medication. For PRN, which is now called as required medication, you will not find time there. Why? Because it is PRN. It's been prescribed that if the patient needs it, we give when the patient needs it. Okay. So another thing we do with PRN is when you're reading your prescription and you see as required, for any medication you see, it is your job to ask the patient. So if you see paracetamol, you want to be sure your patient is in pain. Oh, Jack, so I see you've been prescribed some paracetamol as a necessary medication. Would you be needing any painkillers? If you have forgotten to ask when you started your implementation, you ask that. But there are other things you may not be able to ask. So if you see a medication such as ondansetron, cyclizine, and you're reading your prescription, you need to ask, John, do you feel any sick? Do you feel kind of sick? Do you think you need an anti-sickness? Okay, that's what you do with PRN medication. If Jack says, oh, yes, yes, please, I will need some, then you would give that medication. So when you're reading, you will dot that you will give your cyclizine or your ondansetron. That's what we do is as necessary medication. Then, and so when you are done giving, remember you have to then put the time and sign. So this is the difference between as required medication and um regular medication and start medication once only. The way you put your time, the way you document is slightly different. but you need to do it right, because as required medication has been on the chart for a long time. But now your exam time, this patient has said, oh, I feel kind of sick. So what you do is you put a dot there. When you're done, you go back there, sign, and put your time. Because I had someone ask me that question to say, Bella, for as required medication, do we need to put in the time? Yes. So please, I hope that I'm able to. I needed to take my time to stretch this because some people are not clear with that one, and that is for hospital implementation. That's for hospital prescription chart. So now I will go to Blessing. I've not forgotten your question. I'll take your question. I would go to community setting, community implementation, community prescription charts. It's slightly different. Our chart that we use, you see that we have just one line, okay? One line. Priscilla has popped a question. I'll take your question. Let me just explain community chart, okay? Community prescription chart. So we see that community prescription chart, the ones we have, you just have them. People feel, oh, it's so simple. It's just one line. Breaking news. If you see paracetamol, if you see the drug is paracetamol, the date is today, the dose is 1000 milligram, the time is now, the route is orally, then the start date is today, the finish date is ongoing. You will then see that there is 6 a.m., 12 noon, 6 p.m., 1800 hours or 2200 hours. So it is into four, unlike what we have, unlike what we practice with. So please note this down. If you can write this down, please write it down. In community scenario for implementation, you will see the different time frame. Please make sure you read all of them, but not that time which you are supposed to dispense your own medication, which is your exam time. So if you note that, you know that's what you're going to give. All right. So for community chat, the you are going to sign and put your date there. So you have different timelines. It says sign, date, and time. Please fill in the three in there, please and please. If you look at the chat properly, for any of you that can access that chat, when I'm done with this video, I would upload the chat so people see what I'm talking about. For those of you that can access the chat, look at it properly. Where you need to document, you need to sign, put your initials, you need to put the date, and you need to put the time all in there. Please follow the instruction. That's the difference between the hospital prescription and the community prescription. Okay? Any of us may get any of these scenarios, and I need us to be aware of it and not be ignorant of it and say, oh, I didn't know, and things. Because some people get there, they see something different and they freeze. Please don't freeze. Think and act, okay? So for this situation, if you're alone, you read or think and just act, please. Right? I hope I'm clear with this documentation. I needed to bring this out because I want us to be very clear with it. Okay. So I'm going to take Blessing's question. Do we check wristband for nursing? Oh, and care home. Most of them don't put on wristband. Most of them don't. Okay. Most nursing home, most care homes, they don't, because it's like their homes. Okay, it's like their houses, it's like where they stay. So they are well known, and if I'm in my own house, I may not be putting on wristband if it was my house. However, please read your scenario properly. Let me put a bonus here, that if you do that and check, I'm sure you should not be penalized for that. If you ever, however, you now get confused, please don't be penalized. But for home setting, please, you can't ask for wristband, please, for home settings, because it's not expected that a patient will be wearing wristband in their houses. But for nursing home, I'm sure if you do that, you won't be penalized. Okay, but they shouldn't have. We normally don't ask for wristband. Even when you ask for ID cards, sometimes they say, oh, I don't have one, or they just flip that question. Okay, so if any of you are being told I don't have an ID card, please don't get scared or don't freeze. Okay, just move on and say, okay, that's okay, at least because the patient's address where you are, which he has confirmed, is the same address as the document you've got. So that's one to let you know that you're in the right place as well, you're with the right person. So, Blessing, am I able to answer your question, please? If I'm able to answer your question, please pop it there for me so I know, please. Okay. I'm going to take the next one. It says, Bella, please, for once only medication, do you have to give it even if it's not within your time? For example, if it was prescribed at 10 a.m. and given 11 a.m. and it has not been given, for once only medication, do you have to give it even if it's not within your time? Now, Priscilla, once only medication is always in your time. Okay, it's always in your time. I'll answer that question, but I want to let you know. Once only medication, most often we see is if your exam time was 12 o'clock, we see that the prescription is for 12. Okay. And so you want to give that one. So even if that medication is prescribed again in regular medication, you want to give once only, and then you code the regular medication. However, if you see a once only medication, your time is 12 and it's written for 10, you are not clear about it. Okay? Because it can be confusing. So if you are not clear about it, your best bet is to put a code to say, I'm not clear about this once only medication. It was prescribed for 10. I would expect that the nurse ahead would have given it, but I'll confirm with the other nurses, or I'll confirm with the prescriber if this medication has been given. Now, what they're looking from us is they want to know if we know how to handle certain cases. Okay, so they trust something that's not realistic to you. Can you handle it? Are you able to act? Or are you able to freeze and you're thinking, oh, what do I do? I don't know what to do. Or some people just go dead on that case and they move on. Please don't ignore what you don't understand. Your best bet, if you don't understand, verbalize it, say it, and then move on. And then if it's unclear, put a code that is not clear. You will not be penalized. We've had different scenarios of people who have gotten to the stations in exam and they get stuck, but they were quick to say something, to say, I'm not clear about this. I w- I'm not clear about this. I would verify, or I would confirm with I'll confirm with the prescriber. So when you do that, you've saved yourself up. You've saved yourself a lot. And so this is better than being unsure and acting the way you are. You're just unsure and then you act like that. So please verbalize if you are not sure about it. It means the prescription is unclear and don't give it. If you know you're unclear about it, please don't give. Put a code. You won't be penalized for that. Okay? So, but most likely your wants only should be your time, then you should give. If it's not your time, please, not clear, code it and verbalize. I will verify or I would confirm with the prescriber. I will confirm with other nurses to be sure about this medication, if to give it or not. Okay. Am I able to answer your question, Priscilla? Please let me know in the chat. Okay, yeah, blessing. All right, good. I'm happy I was able to answer that question. So, Precious, if a patient has the once only and regular medication at the same time, where do you sign and what do you do the other one? Okay, great. Oh, blessing. Yeah, Priscilla, great. I'm able to answer the question. So, if a patient has once only medication, um and regular medication at the same time. I think I said something about that. So, once only medication, let's assume this patient has been prescribed amlodipine 5 milligram once only at your exam time, which is 12 noon. And then you go into regular medication. You see amlodipine 5 milligram, 12 noon. Please, you are going to give your once only medication. Okay, so when you give once only medication, you would go and code the regular medication. I think the code is a 5. please check. I think 5 is start dose given. So please, if you please, you guys, anybody check and confirm what 5, the code 5 means. But I think it means start those giving 5. So that's what you do, precious. At the time, where do you sign and what do you? So you will sign, you will give the once only medication, you will sign the once only medication. That's what you do. Yeah. Start, don't give, yes. So, and then you code in your regular medication, you code it 5, and it means start dose giving. Okay, precious. Am I able to answer that question? Okay. Yeah. So yeah, Priscilla said answered. Good. Oh, Francis. Oh, Francis, how are you? Hi, Bella. For time's sakes, um, do you have to read? Sorry, I'm thinking it's another Francis. That's what I'm laughing that way. I think it's a different Francis, but that's okay. But do you have to read all prescriptions that is not within your time of skipping? Please and please, your best bet is to read the prescription. You can't skip it, please. Your best bet is to read the prescription. However, sometimes you may meet an assessor who says, go on, go on. So please listen to your promptings. Once your assessor says, go on, just keep going. Just try to read as fast as you can. I'm telling you, there are some people are fortunate enough to meet an assessor who says, oh, go on, you have no time. Okay. But please, if you don't have that kind of assessor, you need to read all that you are giving and you are not giving. Because if you read the first page of your implementation, it says verbalize what you are doing. Then it also says verbalize the prescriptions you are giving and the ones you are not giving and why. Okay. So for a patient who is being prescribed amoxicillin and she's allergic to penicillin, when you're reading, you need to read amoxicillin. So you can say, I will not be giving this medication because the patient is allergic to penicillin. You see the reason why we need to do that? Because when we read the marking criteria, the red flags, the last one of the flags says any other point deemed fit by the assessor. And in the instruction, it says you need to read what you are doing, verbalize why you are doing it. So please, the medications you're not giving, you are supposed to read them and say why. So you're saying, I will not be giving because it's not due, it's not yet up to 4 hours, or I will not be giving because it's the patient is allergic to this medication, or I will not be giving because the blood pressure of the patient is 90/50. So that's for a situation where it's an antihypertensive medication. So you see why you need to read and state the reason why you're not giving. Okay. Right. So, Francis, am I able to answer your question, please? Acknowledge if I'm able to answer your question. Okay. Yeah. So 5 is the code for it. Precious, yes, I've answered the question. Thank you. So 5 is your code for that medication which you have given in start, and you will sign it, date it there, and then you code. Remember, when you code, you sign. Okay, so you put the 5, circle it, and then sign. Don't forget to go to your last page to document medications not given. So those medications that are due your time that you didn't give and then you coded them, you must write all of them. So those are called the omitted doses. You have to write them properly in full. So if I were you, as you're reading and you realize I'm not giving this medication, it's my time, but I'm not giving it because the patient is allergic, you will code it, circle, sign, then you immediately go to the back, please, immediately, because some people forget. Immediately go to the back, write everything in full, sign, right? So documentation is very important in implementation. Make sure you do a thorough documentation. Make sure you check properly. Some people are done. Hi, Vivian. Welcome. I see you. Okay. So some people um go in and then they just rush it, and then because they want to go back to speak to the patient, what are you trying to say? Some people want to say, okay, I want to encourage you to take your medication. Please, before you encourage the patient to take their medication, make sure your document is properly signed. Make sure you've done, crossed all your T's, dotted your I's. Okay? Yeah, please, if we have more questions, let's pop it. Let's pop the questions in. Yes, let me use this time to say, please click the like buttons for me. Please help me click the like buttons. And if you're here, you've not subscribed to my channel, please subscribe and share to your friends. Okay. Um. Yes. So if we've not had any questions, we don't have any question yet. So I'm going to take on more points, things to avoid, and how to keep tabs with your station. Okay, yeah, thanks for those putting the likes in. Thank you. Please go and like the video. Thank you. um Another thing is, please be careful to listen to your assessors. Okay, where they say something, it's either they're giving you a sign that you have not done something, or it's like a reminder. So you must listen to the promptings. Don't hear their voice and freak out and like, oh no, please. When you hear their voice, look again, look at your actor, or look at your procedure, or look at your skill station and think, is there something I'm missing out? Okay. So listen to the promptings of your assessor. They're not there to fail you, I'm very sure of that, but they're looking out for key things which you have to do. All right. Now, you have some assessors, like I said earlier, they'll tell you when your time is running out. Okay, but some won't tell you when your time is running out. So you need to do yourself that favor of checking your time. Okay. Another thing you hear sometimes is the assessor would ask you a question. So some will say, oh, what about this medication? It may mean you need to check your prescription very well. Maybe you've missed the medication, or maybe you were supposed to do something. Okay. So when you hear their voice, listen in, think, then take the next step. So follow that structure of listen, think, and act, or read, think, and act. That will help you big time. Okay. So Vivian, please, my problem is when the assessor says all checks done with the exception of medication skills, is it required to do ID check? Right. Oh, okay. Thanks for that question, Vivian. Though, the question is slight different from what I answered earlier. So, all medication stations, you have already said exception. All medication stations, you must do the ID check. Okay, but what are those stations that are not, that are just skills, that are not medication station? So let's assume insertion of the NG tube, catheter removal, MSU. mm, which other station? All of these stations, once they tell you I am all checks done, you don't need ID check. Okay. Now, because most likely your assessor will read the scenario to you, or their your scenario will contain the details, the patient's details. So please, you don't need ID check for those skill stations that are not medication. Okay, Vivian, am I able to answer your question? Just go straight into the act and what you need to do. All right. Yeah, am I able to answer your question, Vivian? Please let me know. Okay, Francis says question answered. All right, thank you so much. Another question, I came across tips in OSCE that states to avoid drugs like pills and satin when doing pre-op medicines. Can I verify that? I don't know what pills and satin is, or I don't know what that is. If you can give me the full meaning of what it is, I don't know what group that medication is. However, you're talking about avoid drugs, pre-op medication. Uh, to avoid drugs like pills and things when doing pre-op medication. I've never heard this before. This is new. It's the first time, and I don't know what, because your pre-op scenarios you would need what's that? Pre-op planning and then implementation. Do we have pre-op implementation? Pre-op implementation. I've never heard this. It's really strange for me. Sorry, but if you can type in there, Francis, what it is, yeah, maybe we can. But I've never heard anything like this. Avoid drugs, and from other scenarios, I don't think I've heard anything. We've not had experiences like this. Avoiding drugs. Okay. Losartan and enalapril. Right. Oh, okay. Okay. All right. Thank you, Jeremy. Okay, hi, Tapa. N- Mm, I've never heard that. We don't avoid the medication. No, please. I don't know where you got that from, but no, we've not had any situation where you're being told not to give antihypertensives before your pre-op implementation, pre-op scenarios. Okay, so we want to look at pre-op scenarios first. And I think the pre-op scenarios, I can remember the medication we have for pre-op scenarios. And I know when we give when due, we're not giving just because they're going for surgeries. No, we're not saying we won't be giving because they're going for surgeries. We don't have any scenario like that, Francis. Sorry, I've not heard that before. We've never had any scenario or situation like that. So yeah, I can't tell you to not do that. Please, the medications you are to give are medications that are due your time. The patient's blood pressure is within range, you give. Okay. Losartan, yeah, losartan and enalapril, yeah, the patient's blood pressure is within range, and then yeah, you have to give, and it's due time, the time you have to give, please. Okay, we've not had, except people are trying to bring in new strategy. And when I mean people, I mean maybe the test centers, but we've not had any scenario like that. Francis, I hope I'm able to answer your question. Jeremy, thanks for letting me know. I really got like off taken aback when I saw Prius and Satan. I'm like, what's that? Yeah. Okay, yeah. So please, if you see those medication, you need to give, Francis. Okay. Do we have any question? Do we have more questions, or do I um continue with the present with what I've got to share with you guys? Or does anyone have more questions? I have something to share with us on skills. So for those of you, please just keep. Oh, I'm sorry, Vivian. Please, my problem is when the assessor says all checks done. Oh, I've answered that question. Okay, I'll answer it again, Vivian. I've answered your question. I said, okay, your question says all checks done with the exception of medication skills. Is it required to do ID checks? And I said, no, you don't need to do ID check if it's not a medication station. If it's not a station that has a skill station that has medication, you go straight into what you are there to do. So, and I made example of insertion of NG tube, catheter removal, MSU, suctioning. Okay, there's a follow-up question. Oh, sorry. Okay, then that means I won't introduce myself to the patient. No, yes, you don't. If you don't want to, it's okay. Sorry, Vivian, I did see the next one. Yeah, it's okay. If you don't want to, now some assessors will say just go in and start. Some will let you know just start with getting your equipment. So again, listen to the promptings of your assessor. But what is best for you? For me, to get me into the act, because most of us are used to, I come into my patient room, I check for scene safety, I see that the scene is safe to approach, I perform my hand hygiene, I check there's within date, take an ample amount, using the 7 steps of you see, I can say it. So I know that that's the same way some of you are able to have that in your head. So for me, once you tell me all checks done, no ID check done, what I will do to get myself into the act, into the setting, I just go, hello, good morning. My name is Bella. I'm here to insert your NG tube. The purpose of inserting it is so that you're able to have your nutritional intake and because you're going for surgery and things like that. Is that okay? I'll be going to get the equipment. Would you need anything? Here is the call bell. Are you in any pain? All right. So here's the call bell if you need anything. And then you go out. So I've put myself in my setting to understand my flow. Okay. So it's up to you. Some people will not need to, some people don't need to ask a question, ask their name, ID check, and they can get into the flow. But you, what works for you? Remember, we need to bring in our individualities when we're doing this. Okay. What works for me? That's what I want to use. What works for you? That's what you want to use. Okay. So, Vivian, yeah, have I answered your question? I hope I'm able to answer your question. Okay. Yes. If we have more question, Yeah, thanks so much, Bella. Well understood. Last question. It doesn't have to be your last. If you've got more questions, please pop it, because I tell you, these questions are going to help every other person. Because sometimes some of us are slow catchers, some of us are fast catchers. So for every time we ask the question, other people are benefiting from this. That's why I like to have general questions. So thank you, Francis, for all your questions. I have a feeling I don't really know Francis, but that's all right. Good to have you here. Um, the frequency of a drug is nocte. The frequency of a drug is nocte. This is due my time at 1100 hours. Can I serve or code? And do they normally change the doses of drugs? Oh no, I don't understand the second part about doses, Francis. So, but I understand your first part where you say the frequency of a drug is. I think I know that name, but the frequency of a drug is nocte, but is due my time 1100 hours. Please, we know nocte is night. You can't give, please. Okay, you can't give. So it's not clear. Okay, so it's like this is 10 a.m. and prescription is saying nocte. They are contradicting themselves. So those are the kind of prescriptions we say are not clear. I know we have a scenario like that, and I think I've explained to some people that it is sometimes is due to error, sometimes on the case of on typographical error, or where you're editing and copy and paste things. So but if you see something like that in exam, ideally you don't give, because the prescription is not clear. And so if I were you, if I see something like that as I'm reading, the medication is amlodipine, the dose is 5 milligram, the date is today, the time is 10 100 hours, the frequency is nocte. When you read that, and you read the start date is today, the finish date is ongoing, prescriber signature, Dr. S. Kant, prescriber bleep number 110, blah, blah, blah. I will not be giving this medication because it's not clear. It says 10 a.m. and the frequency is also nocte. I'll be coding this prescription as not clear, and I'll be escalating to the prescriber for clarity or to confirm the prescription. All right. So that's what you want to do if you ever see a scenario like this. Yeah. Then you said, can I serve or code? No, please, you don't serve, you code it. Okay. And do they normally change the doses of drugs? Please, Francis, I'll need you to ask that question again because it's not clear. I would like to answer the question properly. Okay. But I hope I'm able to answer the first part of the question. Right. Okay. Vivian said, well answered. Thank you. Yeah. Blessing. If you're giving IM, yes, please bring in the skills questions, please. If you're giving IM administration as community scenario, do you also treat the pain assessment as a community scenario? Hmm. Now, blessing, you know that before IM comes pain assessment. I mean, that's always what we do. I think that's the pattern anyway, and it has not been changed. So, what you most likely they might tell you if all checks are done or all checks is not done. They will tell you. So, but your pain assessment is basically asking the patient a list of questions. So, I don't know where your community is going to come in. The community vibe is going to come in then. Okay. I don't know where that's going, but the scenarios I've seen for pain assessment is hospital setting, because if you read your scenario very well, yes, please, I need to say something about reading scenario in case I forget. If you read your scenario very well, they will tell you, oh, this patient has just been brought into the A&E after accident and has got a big wound. Please go and assess the patient's pain. So if you have a scenario like that, you can't approach it using a community setting. You can't use it. You can't use community setting to approach it. If you get what I mean, blessing. So it's your scenario that will determine what you will do, because it will determine your setting. It will let you know if it's a hospital setting or if it's a community setting. Okay. So, and then your IM, we know most likely it's always a community setting, and that's how it's going to be. All right. So you just go with what you see at the start of your station. They would explain to you, go with what you have been told. Okay. So before I jump into something else, please and please, let's read our scenario properly. Let's understand our scenario, and let's listen to the assessor when they're reading, because sometimes the assessor will read it to you. Now, I'm bringing this up because there was someone who saw a wound, and then I think the person started wound assessment, and the scenario was supposed to be pain assessment, because in the scenario the person was supposed to carry out a pain assessment on a patient who has just had a big wound. But because the person didn't listen to the scenario, didn't read it, didn't understand it, the person went and carried on wound assessment. So please, it's very vital for us to read and understand our scenario. If the assessor reads it, you didn't understand. Remember, they've not started your time. Please ask, oh, assessor, please, if you don't mind, can you explain again or can you read it again? I'm trying to. Some will give it to you to read. Please take it and read. Make sure you understand your scenario. So they're not asking you to do pain assessment and you're carrying out wound assessment. Remember, your time will not be stopped. And yeah, you may fortunately meet assessors who are really nice and they'll tell you, no, that's not. But please, we don't want to get to that point. Okay. So, yeah, listen to your scenario, you will know. Okay, well answered. Great. Thank you. If we have more questions, please let's pop the questions in the chat box. And don't forget, please like the videos, please. All right. So what question have we got any more questions? Pop them in and then I can speak about one. So I want to talk about ANTT. So I've been able to, I think yesterday or yeah, 2 days ago, Thursday, Friday, I've been able to share with some people ANTT station, the latest development. And so the plan is for whatever strategy, for whatever question is brought to you, you must have a plan and a strategy to attack it. If you get what I mean. So we're looking at, if they give you a scenario you don't really understand, that they change something, like you open your pack and you see something you don't know. The plan is, what can I do? Think immediately. So the recent change we've seen for some people is that the the recent change we've seen is that the you have to put in. Some people got to the place and they needed to put in something, maybe the dressing pack, or if the trolley is small. Yeah, if the trolley is small, you know, because the trolley is small, you may struggle with having to put in an extra sterile gloves or where to put it. And I've shared with most people to put it in. Please, gradually, when you're opened your surgical gloves, don't open it on the side if you've got a small trolley that cannot take it. Rather, as you open it, while still having it in your hand, open the paper, open your gloves into your sterile field, into the pack, without touching anything in there yet. So as you open the pack, the first thing you want to do is take your glove, pour it in, open it totally, throw it in, not without the paper, not with the wrap. Okay, just only the gloves, throw it in, then get your the micro pour, which is your dressing, open, put it in. For every time you do something, perform hand hygiene, put the next in. Then you pick up, take your forceps, most likely you should have a forceps. Okay, and then begin to arrange your field properly. I noticed that some people unconsciously contaminate their field. Please, we need to be careful. If you ever get ANTTs as a scenario, you have to make sure you are conscious of your field, that nothing falls out. If at all it does, you need to acknowledge it. Say what you will do in clinical setting, listen to the instruction from your assessor, and then move on. If you are ever told, okay, start again, because some people say in clinical setting, I will start again. If you are ever told that, don't get scared, please. Just put it in your head is I will start, I'll get my pack. Some will tell you the trolley has been cleaned. Just continue. Please and please. I always encourage people, put in your best. These things are what you know. There are things you know how to do. Put in your best. You will do it. Don't get scared if you ever hear start again. We've had scenarios where they told somebody start again and the person passed. So please, okay? But you must acknowledge your errors. You must acknowledge that the field was contaminated. Okay? Let's be very conscious of what we're doing. That um, don't assume that the assessor has not seen it. Remember, the video is also watching. Okay. Another thing I shared with people when they're wearing their surgical gloves. Yeah. When you wear the first one, most times we always use our non-gloved hands to arrange the first gloved hand. So your best bet, what you need to do is get put your hand inside the glove while your hand is faced upwards this way. Please don't face it this way. Face it this way so that by the time you take your non-gloved hand, you start to adjust your gloved hand from the inside out. I know why I'm saying this. I was able to share this with some people. Please, we always need to have best strategies to help us win at this game. Okay? Please. Um Someone said, oh, okay, 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 Francis, thank you, Bella. First part, well understood. The second part is to clarify if they mostly change drug doses and expect you to identify the error with the dose. No, 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 no. Now, if I understand you, Francis, I think what you mean is, I think I've been using amlodipine. So let me continue to use amlodipine. Like normally people would expect amlodipine to come in fives or tens. So are you saying if they see amlodipine 8 milligram? I think that's what I understand from your question. The second part is clarify mostly, do they change doses and expect you to identify the error? Like, oh, you see amlodipine 8 milligram, and then you say, oh, this prescription is not clear. I would like to. Um, I'm not sure they do that. I mean, the goal is not to make people fail. The goal is to for the nurses to show their competencies, to see that they're able to practice properly. However, because you have brought this, if we ever see something like this, if you ever are unclear with a prescription, your best bet is to say you are not sure about this prescription. It seems unclear. I will contact the prescriber, verify, and then come back to check it with the patient. I'm telling you, if you do that at any point you are not clear, you are in the best place than not being sure. Remember, your expression will show you are not sure. Okay? They're not being sure, and then you're going on to give and just. So please, if you see anything like I'm not the pain, we're used to 5 or 10, and then you see 8 milligram. I'm not really clear about this prescription. I'm aware of I'm not the pain coming in 5 milligram, in 10 milligram. So I'm not clear of this prescription. I'll be coding it. Remember, when you don't give a medication, you need to say why. So I'll be coding it. I can't remember what the code is for not clear. I'll be coding it. You code it, sign, and then I'll escalate to the doctors to confirm the right prescription. So I'm sure if you ever see something like that, if you do that, it's quite acceptable. I'll use paracetamol again. Paracetamol is very common. We all expect paracetamol to come in 500 milligram or 1000. Okay. But if you see paracetamol 700 milligram prescribed, of course, you want to acknowledge it and say, I'm not sure about this prescription. It's not clear. I would like to verify with the prescriber, or I would like to verify, with the doctors or whoever, or the pharmacist. Okay, I'd like to call the pharmacy, confirm before I'll be able to go on with this. So I'll be coding this medication I will not be giving. It's your best bet to use, it's your best strategy. Okay, so Francis, was that what you meant? Am I able to answer your question? Please let me know. All right. Yes. Oh, Pabrina, thank you. Best bet is ask the assessor. Ask the assessor. Now let me share something about asking the assessor. Okay, okay, she's asking the question. Oh, well appreciated. Good. I'm happy you understand that, Francis. Yeah, Pabina is asking the question. No, please. Now, our conversation with our assessor is supposed to be just to talk, listen, respond, especially when our time has started ticking. Please, when our time has started ticking, let's be careful what we say to the assessor, what we are asking the assessor. The only time we're meant to continue having a continuous conversation with our assessor is where the assessor is the one acting as the patient and she's responding. However, even if she's responding, you don't need to keep turning and looking at her to say, oh, assessor, am I supposed to? Okay. What you do is look at your patient, talk to your patient. If you have a dummy, talk to the dummy. Whatever is there, talk to it, but listen to the voice of your assessor. Okay. Now, if for this case, I think what Prabina is asking is, do we want to ask the assessor that the prescription is right or wrong? No, because it will seem like you're asking for answers from the assessor. It's like you're asking for solution from the assessor. So you can't say, oh, assessor, I see this prescription is 700 milligram. Is this the right prescription? You can't do that, please, because it's like you're asking her for the answer. Pabrina, is that what you mean? If that's what you mean, we can't ask the assessor for the right figure. Okay, we are to say that we are not sure, we are not clear, and code it. And that's the reason we have all of these codes for you to use it. They want to know what you will do in practice. And if you do that in practice, it's very acceptable, it's quite acceptable. Okay. So I think I've spoken about ANTT. If you're not clear about what to do, if you see a small trolley, please let me know. However, you may see a big trolley. Please, if you see a big trolley, open your sterile gloves on the side, just by the side. Okay? If we have any questions, let's pop in the questions and then we can answer it just before we round up, please. I want to say something about assessment and evaluation that are very important. Now, we see in assessment or evaluation, any point in time we talk about the A to E, we need to be clear about mentioning the qualities of those checks we've done. So, Pabrina, thank you. Great. You understand. I'm happy about that. Great. So, airway. Airway. I can tell you've been talking to me. There's no visual obstruction. Your airway is patent. You've said that. Breathing. Now, you know that in breathing, we check pulse and then check respiration, then apologize for checking respiration, tell them the figure, immediately talk about the quality of the respiration. Your respiration, after you've apologized, you've told them. Now there is no use of accessory muscles. You're not in any respiratory distress. There's equal rise and fall of your chest. Equal, you want to say those things. Please, you can't miss them. Please go A, B, C, D, E. If you go that way, you won't miss it. Go that way, check your numbers. Then, you've done your AB, which you've talked about the respiration, the qualities. Then your C is circulation. Now talk about your pulse, which you have done. When I did your pulse, it was 78, it was full, it was regular, it was bounding. You need to mention those things. Now we've done the C. And so you also want to talk about the oxygen saturation, the capillary refill time. Okay, please and please, when we press the nail bed, we check for 2 to 5 seconds. We check for 2 to 5 seconds. I know we used to say 2 to 3 seconds, but yeah, from documentation, Royal Masting, and that's why we're keeping it at a range. So I'll be depressing your fingernail for 2 to 5 seconds to see, and I see that it returns within 2 seconds. So you want to say that I've checked and your capillary refill time was within 2 seconds, right? You talk about that, and then when you go to your D, you check the patient. Of course, after your circulation is where you check your blood pressure, all of that. Okay, then your D. Once you have confirmed if the patient is alert, please, this is not where you're asking all the questions in the world. What is the time? What is, who am I? What is the month of the year? Pick, especially if it's not a case of confusion or dementia. Pick two questions. Do you know what time of the day it is? Or do you know what time of the month is it? Or what day of the month is it? Or what year of the month? Pick two, three questions. Once the patient is able to answer your questions, you know the patient is alert. So I can see you're alert, you're not confused, you're able to respond to my voice, you're not in pain, or just say all of those things. You're very responsive, you've done your ACVPU, and then you move on, and then you then ask, have you been able to pass urine in the last 8 hours, or have you been able to pass urine recently? Please save your time. It's not about going to ask what was the color of the urine, what was the quantity of the urine, was there anything in the urine, was there pus or blood. Please, what you want to know in this time is, have you been able to pass urine in the last 8 hours? Okay. Now, when you ask that, the patient says, "Oh, yes, I've passed some urine." Look at your time. If you feel you need to be convinced by asking the quantity, that's okay, but that is really not so necessary. All right. The next thing you want to ask is, when was your blood sugar last checked? Or are you a diabetic person? Or are you diabetic? When was the last time your blood sugar was checked? All right. Then you do all of that. And then you go to your E. Some people start their E by checking temperature. Some start by um, checking for exposure, any bleeding, any rashes, any bleeding, rashes, injury to any areas that is your body is not, your clothes are not cannot show. Okay, so you do that, and then please, the question of medical history is not a medication history. So some people say, "Can you tell me your medication history?" Please, it's not medication history. When you're doing your exposure, when you're doing your E, you just want to ask, "Please, can you tell me a bit about your medical history? Any recent surgeries?" Things like that. So the person says, "Oh, I've had knee implant 3 years ago. Oh, please, can you let me know, are you on any regular medication?" And then they tell you, when you ask those two questions, you're okay. Do your temperature, you've covered your E. The same thing you will communicate. So for your A to E, you need to say all of this when you're carrying this out in assessment. Coming to evaluation, you know that the evaluation, having done all that you need to do, when you want to start talking about what you have done for the patient, then you say, when you're looking at mentioning that's the assessment. We're using situation background assessment. When you get to the assessment, you read out the observation you got on assessment. Your blood pressure was this, your temperature was this, your this was this. Okay. However, we then carried an A to E assessment. In the A to E assessment, now you were mentioning the qualities. When we carried out the A to E assessment, your airway was patent. There was no obstruction. You were able to speak to me properly. Your breathing, you didn't use. There was no use of any accessory muscles. You were not in any respiratory distress. There was no respiratory noises. Circulatory, you were warm to touch. Your capillary feed time was within 2 seconds, and your pulse was regular, it was full, it was bounding. For disability, you were alert, you were not confused, you responded to my voice, the patient responded to my voice, the patient was not in pain, and the patient was responsive. Okay. Then that's the D. Then E, you then talk about, there was no bleeding, no rashes in the patient's around any of the patient's body. There was no rashes, no bleeding, or any injury. And also the patient has had knee implant in the last 3 years and is on some medication. So that's what you now come to say in your A to E section when you are doing your evaluation, which is your ESPA. Now, because most test centers now are looking for those points, you need to be able to say those points. And that's why I'm taking my time to stress it out for us to use. Okay. So I hope we understand what I've said. Please, if there's at any point you don't understand what I've said, please put in your question there and let me know. We'll be wrapping the session very soon. But please don't forget to like my videos. If you've not subscribed, please subscribe and share with your friends, please. Okay, you can come back when I'm done. I'll edit, and then you can share with your friends and those who you know are having OSCE exams. So I'll take Priscilla's question. Bella, please, in the marking criteria, there is pain at disability. Do you still need to ask for pain if you've already asked in your intro? So, yeah, what I do is, and what I encourage, what I teach is, so when you get to pain, it's ACVPU. Okay, you are alert, you're not confused. Okay, you're alert, not confused. You're responding to my voice. Earlier you said you were in pain. Normally, if it's a patient who is unconscious, that pain is to check if a patient is in pain by pinching those trapezius muscle. Okay, so that's what it is for, because we're checking if the patient is alert. So that is not where you come to ask for pain. However, you can say, just for the mention, you are not in any pain. So it's not where you come to ask for pain, please. We don't ask for pain when we get to ACVPU. It's not, it doesn't fulfill the purpose. Okay. On assessment, we ask for pain. And when we ask for the pain, the patient has said all of that. So when you come to your ACV, your ABCDE in disability, you can just say, oh, you said earlier you're not in pain or something, or you're responsive. That has covered you. So please, you don't need to ask for pain. All right. Priscilla, did I answer your question? Please check if I answered your question. Then, few tips on professional values, evidence-based practice. Professional values. I'm happy you guys have been on the word, you've been exposed a bit, you understand some things, how they work. Now, there are key words you are able to use in your professional values. So, if you have read all them scenarios, you've read your marking criteria, there are certain things you must do in all professional values. You must acknowledge that something is wrong, or you must acknowledge the situation. So, save that in your head. You must raise concerns. Now you're raising concerns with your manager. And when you're raising concerns, you know that it is not with your own reason. It must be honest and clear when you raise concerns. Okay? So if you have that, you know some points that you can't miss. Whatever the professional value is, you must raise concerns. Another thing we must do, we must datix, and this is incident report. And when you write incident report, we know we must sign date, time. Write date, write time, and sign. So if you have key points in your head, in your professional values, then you now consider the specific topic. Now, it may be racism, it may be bullying, it may be falsifying observation, whatever it is, you may then be able to pick the peculiarities with those topic and use it to write your professional values. For people like me that can't cram, that's the best way we learn. We group things, put them into group, and pick it when you need it or where you need it. Okay. For your evidence-based practice, your best bet now, recently, we see that your scenario you will be given is most likely very similar and relatable to what you have in your marking criteria. So for those of you who have read your marking criteria, you see it, you understand it. When you see your scenario, when you then read your article summary, I'm sure you just realize these things are close, but please make sure to write the points properly, write them well. Okay, I thought to bring this with consent of professional values and evidence-based practice. Okay. So we don't have any questions now. So I'll just share the few tips. Please, before you go for your exam, make sure to eat. I know some people want to, oh no, I just want to get it over with. Take something. Remember, your brain needs glucose so it can function and think properly. Okay, make sure to eat something. Remember to speak to your patient or your dummy and not the assessor. Remember to speak to your dummy or the patient. I told some people some days ago that I read in one of the booklets where it is written, communicate with your patient. So please face your patient, talk to them, and not the assessor. Face the dummy, talk to the dummy. Be audible, let them hear you. Okay? Always verbalize what you are performing. I've once stayed with some people during practice, and the timing was too uncomfortable. And I had to say, hey, your silence is getting too long. You need to verbalize as you go on so that whatever may be the assessor didn't see, she would hear. Okay, so please verbalize what you are doing as you go on. Be very audible. Go with an open mind to accommodate any changes and do not panic. I cannot overemphasize this. Do not panic. Go with an open mind. When you get there, they've changed the silver trolley to green trolley. Don't panic. When you get there, if you have to do BLS, and before you tell the helper, oh, do you know how to use the back valve mask and connect? If she has connected it, take it up from there. Some people struggle. Oh, why is the person connecting it for me? No, they've made your job easier. Okay. So if you see that they're doing certain things that you were supposed to say, they've done it, please take it up from there. Do not panic. Don't freeze. Okay. Because most times our response is we freeze and then we think, oh, am I doing the right thing? Please focus on what you are to do. Let the helper focus on what they are to do. Okay. I thought to bring that there. Okay. Then this point is very important. If you feel you've made any error in any station, once you move to the next station, please forget that error. Okay. Forget about errors from previous stations. Why? Because what happens is you carry that error onto the next station in your head, and then you're destabilized. You can't function properly. You can't do things properly in the next station. And now, if peradventure someone was to, you know, have a receipt on that station, when you take it to the next station, the effect goes on. So, and we have seen in so many cases where people have worried they've made mistake, they may fail the station, and they didn't fail. So please don't carry on worries from the previous station onto your next station. If you don't remember anything, please remember this. Don't carry worries from previous station onto the next station. When you get to your next station, focus on that station and deal with it. Remember, the previous station is gone. Your time is over. Okay? Rest and sleep properly the night before your exam, please. Don't worry too much. Don't stress too much. I know a little anxiety here and there, but try to bring in calmness, please. It's very important. We've seen other people, we've seen the situation. Some just say, Bella, I just don't know what happened. I don't know what happened. I just got confused. Oh, Bella, the anxiety was too much. I just couldn't finish. And these are the same people who will practice and finish, and they have 2 minutes extra, they have 3 minutes extra, but they get there and they're like, don't let your anxiety be too much, please. Try to control it. I understand how you feel. I know how it is, but please put in your best. Give it your best shot. Control your anxiety. For any time you notice it coming up, try to take in deep breath. Okay? And then it does work. It really does help. Okay? Pay attention to details and stay alert at all times. Pay attention to details. Read your scenario. Ask questions. An opportunity is given to you before you start. Would you like to ask any questions before we go on? And some people are already like, oh, yeah, that's okay. Yeah, yeah, let's just get on with it. No, please. If you feel there's a question you need to ask before your time goes on, ask the question. Okay, so you don't go in halfway and then you're beginning to ask your assessor questions. Please, there is a trend which I've seen. People who are trying to seek answers from their ancestors in between, it's always funny. And please, we don't want that repeating itself over time. Okay. Instructions should be read and well understood at all times before proceeding with your station. So please understand what is expected of you. There is a difference between an expectation and what you are doing. When you understand the expectation which you will get from your scenario, from your instruction, you would know what to do. Just like what I shared with you guys now. Someone just saw a wound and expected it was wound assessment. And she started assessing the wound, used her everything, checked the edges, smell, foul smell, everything, and sending swab. But that was not the requirement. The expectation was for her to carry out pain assessment. But because the person didn't read the scenario, so please, we must take time to read our scenarios and understand it. Take time to check time. As you walk, check your time. As you walk, check your time. Please, as you walk, check your time. Okay? Yes, so these are just few tips I thought to share with us. And thank you so much for coming on. If you don't have any question, I think we'll just be wrapping up. And don't forget to like the videos, please, and subscribe if you haven't, and share with your friends, please. Do we have any questions, or do we have anything that's not clear? If we don't have, we'll wrap up. I want to say a very big thank you to all of you who have joined in, to Francis, Pabrina, Princella, Vivian. Oh, Caleb, thanks for your support. Oh, thank you, Caleb. I didn't know you were here. To Caleb, to Gerard, Jeremy, Vivian, Precious, yeah. Um, to all of you, thanks for taking the time to come out to share. Badr Khan, Blessing, everybody that's turned up, Linda. I want to say a very big thank you to all of you for coming in. Thank you so much. Remember, if you've got any questions, let me know. I'll be able to do my best to support you. Send me a message. I'll be able to do what I can. Remember, I mean, I'll be the happiest if we could have 100%. Yes. Yeah. So I'm wishing you all the best. Yeah. I'm wishing you all the best. Yeah, you got this. You all know what you are doing. You're registered nurses again. It's just that you need to prove your competence that you can practice in the UK. And you all got this. I know you can do it. Go out and win. All right. Go out and win. All right. I already shared in. Oh, thank you, Pabrina. Thank you so much. All right. So till I see you guys again, I'm hoping to hear from you guys. I know some people will call Bella. I'm just done with my exams. I know some people will call, oh Bella, I don't know how it is. It's okay. Just express yourself. Allow yourself, go through the exam and have your own experience. And then by Wednesday, Thursday, Martha, I see you. You didn't ask any question, Martha. Anyway, that's all right. um, go through your own experience. By Wednesday, Thursday, we'll be having our results and we'll be rejoicing and happy. Hopefully, I wish you all the very best. Have a great, great time. See you, everyone. Thanks for joining in. Bye.